There are risk factors for breast cancer, and a lot of women talk about family history, and family history is important. But as we talked about, 1 out of every 8 women will develop breast cancer with no family history. Family history can be important. If you have a male in your family who's had breast cancer, that means your risk is even higher. And even saying that shows that men do get breast cancer. About 1 out of every 100 breast cancers is diagnosed with a man. And a man would have a change in his nipple or a lump in his breast. It's generally treated with a mastectomy because the size of the lump related to the man's breast is such that doing a lumpectomy usually isn't very helpful. Reconstruction can be done with the nipple complex as well. But it's equally treatable in men just like it is in women, and in a lot of the similar fashions that we do. Most men, we don't generally recommend breast self-examinations in men. If somebody has a very strong family history, they might want to consider that though, particularly if they have a family member who has the gene for breast cancer, a mother or a father who has the gene for breast cancer. If their father had breast cancer, or their mother was diagnosed with breast cancer under the age of 50. If their mom's still around, it would be good to maybe have that person checked to see if she has the gene for breast cancer. If she doesn't have the gene for breast cancer, she couldn't give it to you. And that's the other thing to remember. A woman diagnosed with the gene does not necessarily give the gene to her child. Even if she has breast cancer at a young age, does not necessarily mean that she has that gene. So she should be checked. If she doesn't have the gene, she couldn't pass it on to her children. But if there is a genetic predisposition, particularly that very strong family member under the age of 50 with breast cancer, and the younger, the more concerned we tend to be, that man might want to be checked regularly and see this physician and make sure the physician knows about their history of breast cancer, and look for changes in their nipple or lumps that would be usually right under the nipple itself. Men generally don't get breast cancer elsewhere, although it can happen.